Microscopical diagnosis. No amount of epithelial proliferation and piling up within the acinus is evidence of carcinoma of the prostate, for these changes may be brilliantly illustrated in simple prostatism. It is only when the epithelia break through the stroma that carcinoma can be diagnosticated. The pictures are often so confusing that only the most convincing evidence should be accepted, and this is usually confirmed by the gross changes. Symptoms. Cancer within the prostate gives either no symptoms at all or only the vaguest and most unimportant perineal discomfort. Inasmuch as the primary growth may remain small for many years, bone or glandular involvement may predominate early in the disease. Thus, bone involvement, secondary to carcinoma of the prostate, may be the one clinical evidence of the disease during life. This occurs in a large minority of cases. Sciatica and pelvic pain, due to involvement of the sacral plexus in the glandular metastases, is often one of the earliest symptoms. It may precede the urinary symptoms by several years. Bilateral sciatica in an old man is all but pathognomonic of prostatic carcinoma. Abdominal tumor due to carcinoma of the lumbar glands I have once seen as the predominating early symptom in a patient who died without ever having any symptoms directly referable to his prostate beyond a very slight perineal discomfort. Retention of urine, showing itself by frequency of urination, or acute complete retention quite comparable to that of simple prostatism, is often the first symptom of carcinoma of the prostate. The retention of carcinoma usually begins a decade later than that of prostatism. Hematuria is a less common symptom in carcinoma than in simple prostatism. It occurs late for reasons already stated. It was noted in 22% of Judd's cases. Rectal obstruction and ulceration and urethrorectal fistula are terminal complications, as are edema of the extremities and genitals and cachexia. Prognosis. The disease is usually fatal in 2 or 3 years. The most rapid case I ever saw died within 1 year of the time that my first examination had left me in doubt as to whether there was a small nodule of carcinoma in the prostate or not. On the other hand, one of my cases took 12 years to die from the time in which I diagnosed carcinoma. No attempt had been made to remove the growth.